So semaglutide is a medication that we have used for years for diabetes. The original brand name was Ozempic. Probably when I first came into practice in 2009 outside of residency, that semaglutide was coming on the market. Again, Novo Nordisk came out with Ozempic for the treatment of diabetes. We noticed that we were treating their diabetes, and they subsequently were also having fairly large amount of weight loss. And this was observed for several years. Novo Nordisk then went back and did a study, and now the medication is called Wegovy, but it's still the same medication, the Ozempic and then the generic semaglutide, where they looked at patients over about 60 weeks, and the patients were receiving this medication. The average patient lost 15% of their body weight, or approximately 30 pounds. So the reason that semaglutide has gained popularity is that is an effective medication for weight loss management. For years as a physician, I have prescribed patients numerous medications, including sometimes stimulants. You may have heard of phentermine, which is a stimulant. For years, we're prescribing a lot of stimulants for weight loss. They would work, the patient would lose the weight, and then the stimulant would be discontinued, the patient would gain the weight back, or they become very dependent on the stimulant, and it was very hard to wean them off. Now it's amazing with a medication like semaglutide that we are able to treat patients without a stimulant on a medication that's very, very safe. For semaglutide, there are very few patients that don't meet the guidelines. Really, the only two absolute contraindications would be medullary thyroid cancer, family history, personal history, or family personal history of multiple endocrine neoplasia type 2. Pretty rare cancers, but that's something we always just want to make sure that we're screening our patients for. If they had maybe a history of pancreatitis, they may not be the best candidate. Or if a patient's already on Ozempic, we wouldn't want to also prescribe them an additional generic semaglutide or Wegovy if they're already taking the medication, and we don't want to double dose them. This is a very intensive program with myself, our dietitian, and our nurse that we're monitoring the patients very closely. It is the behavioral modification that works for weight loss. Medications do assist, and semaglutide has been very effective in our patients, but is the behavioral modification. So coming in frequently, the phone calls or the frequent visits with Paige, us looking at your food diary on an app, also looking at your exercise, what else is going on in your lifestyle, maybe that could be providing a barrier for weight loss. But this is something we will work with you. And then at the end of what we require is at least a 6-month commitment. We don't just abruptly stop you and you're off the program. Some of our patients that are morbidly obese and may have well over 100 pounds to lose, they often will require more intensive treatment even after that first 6 months. Other patients may have gotten to goal at 6 months, and then we can determine, okay, are we going to maybe just try a baby dose every month, or are we going to taper off on the medication? And then we have patients somewhere in between that may be close to their goal. Maybe we only need to see them monthly, and then we can determine, the appropriate dosing for them, and then also the appropriate follow-up. Is this something maybe they just check in with us through email, or do they still need to come in? Do they need that close monitoring? And some patients do need that and do need that long term.